Now you're talking. All right.
Is that better?
Louis picked out some carousel music. We've been listening to carousel music for the last 2 months.
All Italian music sounds like carousel music.
Hey. Have some respect here. Oh, that's nice. I like that.
Okay, good.
That gets you kind of, kind of in the mood quite a bit. Good morning, everybody. Welcome to the Sicilian Corner. And my name is Mike. And producing the show, as usual, is our good friend Lou. Lou, how's everything on the island?
Dry. We're okay. We're not flooded.
You're not flooded? You only have one way off that island, right?
I know.
I can't. Once you got stuck, right? Once I got
stuck off the island, not on the island.
Off the island. You couldn't get back?
Yep. But it was for a very short period of time.
Lou lives on Plum Island. I don't know if you're familiar with it because I know you're not from this immediate area. But it's a beautiful island. I'll bet you back in the day, right?
Mm-hmm.
Bootlegging had to be absolutely incredible along that stretch of land.
During Prohibition, yeah.
That's like 11 miles out, right? 11-mile beach?
Yeah.
Pretty close?
Yep.
I mean, can you picture at 12 o'clock at night, the ships coming in, a boat coming in?
I can picture.
Kegs of whiskey being rolled off. I mean, just, a Ford truck picking everything up and hauling it out. That's what I picture every time I'm on Plum Island. I bet you during Prohibition, it had to be a hot spot.
Oh,
it just had to be a hot spot.
Yeah, they had that hotel there, so I'm guessing the hotel was pretty.
What was the name of the hotel? I forgot. Do you remember?
Wasn't it the Plum Island Hotel, or I'm not sure.
Oh, so now you're reaching.
Now you're
reaching.
No, I'm not reaching.
Okay.
Thought I knew it.
Is the Plum Island lighthouse still light up?
Yeah.
That's active. The Coast Guard maintains that.
Yeah, it's automatic. Wow. There's no one mans it, but yeah.
But they have to change the lens every once in a while, right?
Yep.
It's a nice area. Unspoiled.
Oh,
it's right next to Salisbury Beach. Newburyport. It is part of Newburyport, right?
My end, yeah.
Yeah.
Part of it is Newbury, and part of it is Newburyport, and part of it is Raleigh and Ipswich. And, yeah.
No way.
Yeah, the refuge is split between Raleigh and Ipswich, I believe.
I did not know that.
Yeah.
Well, anyway, someday when I grow up, I'm going to be able to move to Plum Island. You know what I mean?
Right.
Hey, listen, folks.
I like to tell everybody, though, second cheapest house on the island, so don't be too impressed.
You got a nice house. Today, this is kind of a serious show. I know we have a lot of laughs. We get around a lot. We have a lot of fun. But today, I want to get a message out because there's an awful lot of folks that suffer from severe pain, chronic pain, and there's nothing worse. And with the technologies, we're living a lot longer. With that comes a lot of ailments, right, Lou?
Yes. Oh, yeah.
Whether it be
especially pain.
Yeah, and pain can be awful.
Mm-hmm.
I've been going to a pain clinic, and this doctor that's my guest today, my co-host, his name is Dr. James Mirazita, and I wanted him to come on and he'll answer any questions you folks have. And the telephone number here is 978-659-0072. Once again, 978-659-0072. You have a question, you're hedging, you're with a doctor that it's not helping you quite the way you would like it to be, someone who doesn't overprescribe pain medication, this is the guy you need to talk to. Hey, welcome on board the Sicilian Corner, man.
Thank you for having me, Mike.
You look totally different without your white coat.
Oh, I know. No white coat, no blue hat.
And when you see I don't have a Johnny on.
Right. It's a whole different setup, right?
It's a whole different ballgame. I'm sorry you had to drive down here with this freaking crazy weather. I'll tell you,
the rain has been just relentless, right?
I was telling Lou. Yeah, I was telling Lou. I drove through Methuen. I took the back way. I stayed off at 93 because I'm struggling a little bit today with my back. And by the way, folks, I just want you to know, I am a patient of the doctors, and I think it was one of the better moves that I ever made. We seem to hit it off. He cares. You're not a number. He doesn't look at his watch when he's talking to you. I mean, today it looks like,
Yeah.
a doctor has to see so many patients. I mean, you got 12 minutes. You better get it out quick. I mean, either that, you're going to be out the door and somebody else is going to come in.
Yeah.
It's just the way medicine is.
It is. It can be challenging at times, but still, I think that it's important to make time with patients and do more listening than talking. So I totally get what you're saying.
Why don't you tell folks a little bit about yourself, where you're from?
So I'm originally from Brooklyn, New York, and yes,
we can't hold that against you.
Some do, some don't. I am a first generation American, proud Italian American. My mother is from the Trieste area, and my father
really?
from Calabria.
Oh, for Pete's sake!
Yeah. So, but anyway, I was born in Brooklyn, and so lived there for several years before moving to Long Island, and then my dad's business took us to Ohio. So I actually feel like Ohio is my second home. That's where I went to medical school at the Ohio State University, College of Medicine, and while I was there, I joined the Air Force because they gave me the health profession scholarship, and
Nice.
So I will always be grateful to the U.S. Air Force for supporting my education.
It was a good experience.
An amazing experience. I met some of the finest people to date in the Air Force, and some of my longtime friends, Air Force veterans. So I can't say enough about the quality of the experience I had.
I hope someday you get a chance to meet my brother. He retired lieutenant colonel in the Air Force.
Yeah.
Became a dentist. Went to Columbia. Went to Holy Cross. From Holy Cross, he went over to Columbia, and extremely bright. What I lacked in paying attention in school, my brother averaged things out a little bit. We always say that because he just loved it. And to me, I used to get edgy. I couldn't sit. Unfortunately, I wish I had paid more attention. But something, here we are, and we look back, and I have a very good relationship with him. He comes over. He's always over the house. He might as well move in, for Pete's sake. But anyway, we have a good time together. And like I said, very, 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 very smart. You're an anesthesiologist.
I am. I'm an anesthesiologist by training. And I did my anesthesiology residency in the Air Force at Wilford Hall in San Antonio, Texas. At that time, San Antonio was the location of the Air Force's biggest teaching hospital.
Wow.
So I was there for about 3.5 years. Wonderful experience. And then after I finished my training, I worked as a staff anesthesiologist at Langley Air Force Base in Virginia, which was also a wonderful experience.
That's a nice temperate climate.
Yeah.
You're not getting the humidity and the heat out of Florida.
Mm-hmm.
You're kind of like, you get the best of both worlds.
True, and you get 4 seasons, but very mild winters. I was fortunate enough to live right on the water. The base is literally on the Chesapeake Bay, so really, really a nice setting. And it was the home of the Air Force's first fighter wing. So you see all the fighter jets doing their practice runs. We call that jet roar the sound of freedom, and absolutely true. I never got tired of it.
I'm laughing only because you're bringing back a flashback. I was in the Army, and I was going through basic training over at Fort Dix, but my barracks was located right next to McGuire Air Force Base.
Oh, right.
They would do these touch and goes.
Right.
Man, holy gee. I mean, you'd go crazy.
Yeah.
You couldn't get any rest at all. I mean, a conversation, you were like yelling to the guy next door to you.
Yeah, it's incredible.
It's incredible what those jets can do.
It really is.
Something, I went in the reserves because I had just gotten married. And my wife, Lucille, she was all excited. Vietnam was very hot. And I managed to get into the 331st General Hospital Reserve Unit. And when I was going through basic, I enjoyed it so much. And I'm serious when I say this. I like the physical aspect of it. I like the timing. I like the discipline. I like the whole 9 yards. And I was a squad leader going through basic. And then when I went to my AIT, is your job classification, I was a platoon leader. And at that point, I was actually thinking about enlisting, going regular Army. So this captain had just got back from Vietnam real quick. He's trying to talk me into it in the worst way. So I call my wife, and he gets on the phone with her.
Oh, God.
And she says, "There's no freaking way I'm out." It was absolutely hysterical. So anyway, you went into pain management.
Yes, I did. So when I did about 4 years of payback for my education. That's how the scholarship program was
Oh, okay.
structured.
4 years.
So yeah,
That's
so
not bad.
yeah, not bad at all. So so I worked as a staff anesthesiologist, and then when I finished, I was able to do a pain fellowship at Beth Israel in Boston, you know, in the Harvard system,
Mhm.
and that was really a nice experience. You know, we focus totally on pain management, what is termed interventional pain management,
Yeah.
which is a minimally invasive type of treatment thought process, and so that's what I specialize in now, and I've never looked back. So I do nearly 100% interventional pain management at this point.
Why don't you tell folks who you're associated with, and if anybody's interested, and where your office is located?
Sure. So my practice is Pain Solutions. You can find us on the web at www.painsolutions.net. And we have offices across the state of New Hampshire.
The closest one being Nashua.
The closest one being Nashua. We have an office in Concord. We have an office in the Lakes region.
Oh, wow.
Yeah. So yeah, we cover a wide part of the most populous portion of the state. So I do a lot of traveling, some driving, but it's all for a good purpose. We see a lot of patients.
Yeah, I know you do. You're a busy practice. Once again, folks, telephone number 978-659-0072. You have a question for the doctor, give us a call. And once again, his specialty is pain management. Most of the folks you see, the majority elderly.
Yes, I'd say the majority are elderly, but we do see a wide mix, all ages, you know, stemming from teenagers, you know, following sports injuries or, you know, developing chronic pain syndromes for whatever reason, to the middle age and the elderly. What I notice in the last 5 years, especially, is that, you know, there are a lot more elderly patients that are a lot more active and want to stay active. And so they seek us out to, you know, instead of just saying, well, you know, I'm old and I'm going to hurt and I'll just, you know, take it easy and sit on the couch.
Do nothing. And that's the worst thing you can do.
And that's the way it is.
Yeah.
People just don't have that attitude much anymore. And that's great to see. So we like to, you know, help people maximize their function and do the things that they really want to do, because let's face it, that's what life is all about. You know, we want to improve people's quality of life, and so that's especially you know, important to me. So I like watching.
You like
that
helping
happen.
people.
I do. I enjoy, you know, seeing people live their life to the fullest.
I come to see you approximately once every 3 months.
True.
You give me a lumbar injection,
Yeah.
epidural.
That's right. That's right. Your procedure is called a transforaminal epidural steroid injection, and this is a technique that allows us to put steroid medication, which is nothing more than a very powerful anti-inflammatory medication.
That's all it is.
That's all it is, right? It's just the most potent anti-inflammatory we have in medicine.
Explain. When I'm in your office and it's time for my procedure, you have an X-ray, a young nurse on the X-ray machine,
Right?
and she kind of guides where the
What's
needle.
her name, Mikey?
They change.
Oh, I was going to say.
They change. I don't go the same day all the time.
He knows all the names.
But my question is, you have a picture of my back and you have your needle.
That's correct.
That X-ray machine guides you, because
Yes.
I have a lot of bone material in my back.
Yes. So the technique is called fluoroscopic guidance, and fluoroscopy is real-time X-ray, almost like a cinema version of X-ray. So it takes frames rapidly as you press the pedal. So when I press the pedal, X-rays are being taken in single frames in rapid succession. So what that does is it gives me a real-time view of your spine. And also by adjusting the angle, and that's what my staff does. I have the greatest staff, in the
Amen.
Right? I mean, just super people. Our nursing staff, our medical assistants, our nursing assistants are just second to none. So it really takes a team to deliver good care, and so I'm very proud to work with them and grateful that they're with us.
I'm able to watch what he's watching in front of me.
That's
and
right.
I love looking at it, and you can see where the needle is going in, because it's all about placement.
That's right. It's it's obviously targeting is key, because you want to deliver the medication to the proper anatomical structure. So in your case, it's the L5 and S1 nerve roots on the right side. And so what we do is the fluoroscope is positioned in what we call a multiplanar fashion.
Yeah.
And by changing the plane of the X-ray beam, we can create a three-dimensional picture on the screen and in your mind's eye. So as I'm guiding the needle, it's a bit like playing a video game, because I guide the
video
needle.
game.
Like it.
Hey,
Yeah. by watching
that makes
the
me feel
screen.
comfortable.
Yeah, and just feeling the three-dimensionality of it by adjusting the plane.
All I know is you're extremely good on what you do,
Well,
and
I
I'd
appreciate
recommend
that.
you, and I have recommended you. So I hope to our listeners, if there is a problem out there, and we're going to talk a little bit more when we come back, but I have to
Okay.
take a break. And once again, the telephone number 978-659-0072. Call up, ask the doctor a question. I know you're out there. Don't be shy.
Yeah.
Louis, why don't we go to break?
Ciao, this is Esther of You, Me, and Sicily. I want to talk to you about Tommy Amin and the great staff at Butcher Boy Market. Families, foodies, and home chefs come together at Butcher Boy to talk good food and create traditions. They offer the best in quality cuts of beef, pork, lamb, poultry, and restaurant-style steaks and chops. Produce? All of their produce is hand-selected to complement any meal or even to make it your main course. Their deli serves fresh roast beef, turkey, and beautiful imported Italian cold cuts, cheeses, and antipasto. And don't forget the Butcher Boy Bakery, featuring sweet delectables from all over the state, as well as their very own bakery. That's Butcher Boy, where the secret to a great steak is, of course, the steak. Located at 1077 Osgood Street in North Andover, Massachusetts, in the Butcher Boy Plaza. Ciao!
This is David from the Sicilian Corner. You know, Mike, Tom, and I love to go to Salisbury Beach, but we love different things and can never agree where to go. Tom likes the casual family-style dining with the great Italian cuisine, Capri's Seaside Italian Kitchen and Pizzeria. Me? I love the elegant romantic vibe Sea Glass with the amazing view and terrific menu, with prices that make it the place you want to visit each and every week. Mike loves a drink in his hand and a cool ocean breeze right off the surf and the rhythms of a cooler reggae band. We all know Mike loves Bob Marley tunes at Surfside. Who doesn't love a great show? National acts, comedy, regional favorites in the beautiful and intimate Blue Ocean Concert Hall. Lucky for us, Atlantic Hospitality is the host of all of these great places, and they treat everyone like they are Mike Lamazzo. Best of all, we never have to choose. Park the car once and all this fun is right at your fingertips. You can have it all in the heart of Salisbury Beach. Find out all the ways you can have a great night at Salisbury Beach at northshorepavilion.com. And Mike, Tom, and I will see you there.
This is Tom Zappala. Located in the heart of downtown Haverhill, the Haverhill Beef Company is a full-service, old-fashioned butcher shop and meat market that continues to be a valued family tradition since 1952. Peter and Monica Carboni's Haverhill Beef offers individualized service from an outstanding selection of marinated sirloin tips, homemade sausage, marinated chicken, and thick, juicy Chairman Reserve steaks. Your family deserves the best, so call Peter at 978-374-4795 or visit their website at www.haverhillbeef.com.
Hi, this is Mike, and I would like to tell you about the Deborah Care Law Offices, a firm that is focused on estate planning, probate, trust administration, and elder law issues. You will feel comfortable discussing important issues concerning both you and your loved ones, as well as having the information you need to make an informed decision about your family's future. How do I know? Because I'm a client of Dan Deborah Care. If you want to have peace of mind knowing that your loved ones are protected, call Deborah Care Law Offices today. In Massachusetts, 978-686-4645. In New Hampshire, 603-894-4141.
At Catadella Funeral Home, we reinvest in our business to provide your family with the best facilities. It begins with a beautifully landscaped exterior, parking for 250 vehicles, and a comfortable and inviting access to our renovated interior. Funerals can be costly, so you should review and compare plans to make sure you receive services that are fairly priced. I invite you to experience the Catadella difference in cost, facility, and service.
Catadella's honoring and celebrating the lives of the people we loved, providing exceptional care since 1929.
Italian artisan cuisine combines simple, fresh ingredients with time-honored preparation to create an incredible culinary experience. At Tuscan Kitchen, located in Salem's historic Depot District, talented chefs prepare everything in-house from scratch for all to see. Guests enjoy their meal literally in our kitchen as food is prepared right in front of you. Wood ovens burn from morning till night, roasting vegetables, baking bread, and firing delightful thin-crust pizzas. Prime steaks are seared on a wood grill. A rotisserie slowly roasts marinated whole chickens and lamb, while a pasta maker creates fresh fettuccine. More than just artisan cuisine, Tuscan Kitchen features the wine bar, live entertainment, weekly wine tastings, and elegant private dining and event space. Call 603-952-4875 or visit TuscanKitchen.com to make a reservation and learn more about the culinary adventure that awaits. In Italy, cooking is an art form. Tuscan Kitchen. Experience artisan Italian.
Orthopedics Northeast and Essex Orthopedics have joined forces as Mobility Bone and Joint Institute to bring improved access and outstanding medical care. While our name has changed, our dedication to exceptional care remains the same as it has for the past 30 years. Same location, 16 Pelham Road, Salem, New Hampshire.
This Labor Day weekend, bring your entire family for the 100th annual Feast of the Three Saints in Lawrence. The best Italian food, free parking, and free entertainment. Stop by the Beer and Wine Gardens, and you'll love the entertainment. A spectacular lineup of talent throughout the weekend. Friday night, enjoy a Phantom of the Opera performance. You'll also see reggae rock artist Joe Samba perform live on stage. Saturday, Chef Marianne Esposito from the PBS series Ciao Italia will hold cooking demonstrations. And Saturday night at 8 on the bandstand, it's the Tre Santi Siciliani Orchestra with tenor Salvatore Bonafini. Come celebrate 100 years of Italian food, fun, and entertainment at this year's Feast of the Three Saints, September 1st through the 3rd in Lawrence. Follow the signs from the Marston Street exit on 495. Sponsored in part by Tuscan Brands, Market Basket, Tripoli Bakery, JG's Ice Cream and Fun Center, Catadella Funeral Home, Trident, Essex Companies, Donna's Sausage, and Jackson Lumber and Millwork. Visit threesaintsinc.org.
This is Cindy
and Mike Consla,
owners and operators of Four Oaks Country Club and Grazie Italian Restaurant in Drake, Massachusetts.
Grazie Italian Restaurant is the hidden gem of the Merrimack Valley.
Why is that?
We have an incredible chef, Oscar Figueroa.
In the words of local famous chef and restaurant owner Lydia Shire,
Oscar thrives on hard work.
He is capable and gifted.
No one makes better food. Scallops, seared to perfection.
House-made ravioli with farm-fresh local corn.
And buttery, tender, lazy man's lobster, just to name a few.
You have to come experience Grazie Italian Restaurant for yourself.
Grazie Italian Restaurant, located at Four Oaks Country Club, 80 Meadow Creek Drive in Drake, Massachusetts. Hope to see you soon.
And if you like the new music that we're playing to come in, please drop us a line. Andy Parisi is saying good morning to Barbara. And Andy, I hope you like the music. I mean, if this doesn't get you kind of in the Italian spirit. Speaking of which, by the way, this weekend is supposed to be nice. The weather, believe it or not, we're going to get like 2 days in a row. It's supposed to be sunny.
Nice.
Hey, listen, go to the north end. Go over to the Fisherman's Feast. A great bunch of guys. They do a fantastic job. The Fisherman's Feast started, I believe, Doc, back in 1910. It's family fun, great food, fantastic tradition. So, you know, something that's going on this weekend. It started last night. And, you know, something you're guaranteed to have a wonderful, wonderful time. Louis, do we have a call?
Yeah, Roger wants to say hi. Go ahead, Roger.
Roger the Dodger. Roger, good morning.
Good morning, Michael, and to you, Doctor, as well.
Thank you.
How you doing today?
Again, this is, and Mike and I had a conversation yesterday. This is a subject near and dear to both our hearts. We both suffer from pain constantly, chronic pain, and I have a couple questions for you.
Sure.
What is your opinion on the likelihood or the benefits of, let's say, a nerve block? And I know Mike gets epidurals. I get shots all over my body. I was very fortunate to have a physician when I had my rotator cuff done at Mass General, Dr. John Warner, who was pioneering a nerve block before the operation, because my shoulder was so bad that and that the relief I got from that was life changing.
Wow.
Yes, it can be profound, and you know, nerve blocks are very good tools, both for preoperative use to provide analgesia or pain relief during the surgery and after the surgery, helping patients recover faster, helping them do their physical therapy type exercises in a pain-free environment. So yes, they can be really good tools.
But again, I don't think, and I applaud you for your dedication to pain management. Only because, you know, whatever else is said, the demographics of the Sicilian Corner is such that people need pain relief. Hey. Come on, Mike. and I actually think you could put this out as under the auspices of a public service announcement.
Exactly.
Because there are so many people out there that are just so from a lifetime worth of work, and I spent 45 years in construction, and you know, I'm a mess. And then there's a lot of people that I've talked to that are in my position, and just to go to a caring individual like yourself that understands what's going on, can be life changing.
Yeah, you know, I'm glad you called in because. You know, you walk the walk, so you know exactly what pain can be. And I've seen you some days where you could barely move. So I really want to say thank you for giving us a call here on the Sicilian Corner and talking to the doctor. And you know something, Roger? You take care of yourself, you hear?
And just another day in heaven, Mike. Oh, look, it's raining out again.
Thanks a lot for your phone call. I appreciate it.
Okay, catch you later.
Thank you. Hey, listen, folks, once again, if you'd like to give us a call, you have a question, there's nothing out of bounds, whatever you want to ask. Telephone number is 978-659-0072. Dr. James Mirazita. I like that. It kind of rolls off your tongue.
It's musical, right?
Yes, it is.
Doctor, let's talk about the nature of chronic pain management. And is it a moving target? In a lot of situations with ongoing prescribed medicine, tolerances are built up and changes have to be made. And you have to try new things. And I imagine it's case to case.
It is. It's very individualized. No two patients are the same, even with the same, you know, disease state or background or injury or more, degenerative type of situation. Every patient is different, and that's why the approach really has to be individualized. And then people's goals are different, so I like to say, I'll use this verbiage in the office a lot. I like to tell patients that I think of myself more as their coach than their doctor, because I want to know, what is it that you can't do now that you would like to do, and educate me on that, and then I can work with you to come up with a treatment plan that may be able to get you where you want to be. And I think it's an approach that has worked for me in my practice, and patients seem to appreciate the ability to kind of guide where the treatment is going, because there are there are lots of different ways to approach chronic pain problems. You can use different techniques, even for the same problem, same circumstances, different techniques and tailor the outcome to better suit what a patient is looking for. So I'll often, when I do my initial evaluation of a patient, not only will we go through where their pain is, what it feels like, how is it constant, is it intermittent, but patients will be given a diagram. It looks like a silhouette of a body, and they'll mark exactly where their pain is on their body, and they'll describe the different features of the pain they're experiencing, what brings it on, what makes it worse, what makes it better, and all of that helps me understand, the best way to tailor.
Everybody's different.
So how do you deal with, this is a good day to ask this, how do you deal with weather-related
pain
variants?
Let's talk about the weather. That's a good question.
Yeah,
it's a great question, and it's a question I get asked frequently, because the data, if you look at the literature in chronic pain, no one yet to date has been able to elucidate the exact factors that go into what makes pain worse with regard to weather. But yet patients will tell us over and over again, oh, I know when the weather's going to change, my body will tell me. I know when the barometric, yes, you do. When the barometric pressure is changing, I know when we're going to have rain. I've heard this for 30 years in practice.
So there's something to it.
There is definitely something to it, and
we just don't know what it is.
Yeah, we just can't pinpoint the exact.
Is it the barometric pressure?
I think that has a lot to do with it.
Yeah.
I think also the moisture level in the air has something to do with the way we feel, and also the amount of sunlight. The or lack thereof often has plays a role.
Yeah. Today, it was slow going for Mikey. Let me tell you.
So do you have seasonal affective disorder for pain too?
Yes, I mean the what we try to do, and that's why I think that's why so many people in our area choose to go south for the winter and so on, because it really does the warmer temperatures, the greater amount of sunlight during the winter really does help people feel better physically, not just mentally.
And I didn't mean to interrupt you, but just to play the opposite of that, I'm at my best in the dead of winter when the temperature's around 21, 22, the sun is out, it's super dry, and I go out for a walk. I feel like it's the best I get.
That's great, and it's very interesting. It also speaks to how everybody is different, because the typical chronic pain patient always seems to do better in warmer weather that's drier. The humidity kind of can exacerbate pain problems, but definitely warmer rather than colder. So once again, Mike, you're unique. No, I think it's everybody is different.
Not only that, I mean, if you're seeing 5 patients, each one has a different pain tolerance.
That's true.
You have a chart and it says, circle what your pain level is now.
Right.
Well, I may put 6, but for somebody else, it'll be a 9.
That's very true.
Or just vice versa.
That's very true.
Because some people can't stand any discomfort whatsoever.
That is true, and we see this. We see this throughout the practice. We use what's called a visual analog scale. It's a scale that's linear. It's written on a piece of paper where 0 is all the way at the left and 10 is on the right, and with numbers in between, and the patient circles the number, and that's kind of the standard pain measuring tool. But I have found over the years this shift upward as we tend to, highlight more painful periods, and the numbers have moved up, it seems, over the years. You're absolutely right that everybody is different with different pain tolerances. But, one thing we've added to the assessments every time people a patient visits is, how much has not only what is your pain score today, but how much has this pain affected your ability to do the things you need to do.
Good point. That's a good point. That's a good point.
And we use a inventory tool to kind of record that in the chart.
Our show is very, very popular. We have our steadies. We're also reaching a lot of new people. And once again, between Facebook and YouTube, anybody can watch the show anytime they want, 24/7. It's a wonderful thing. Right. WCAP 980 puts our signal out there, and they've really done a hell of a job for us. I just wanted to say, for someone out there who's in pain, chronic pain, who's uncomfortable, and they're not happy with the treatment they're getting, how would they go about trying to make an appointment? What's the process of an evaluation with your office?
Well, great question. It's actually very easy. Best thing to do is to give us a call. Our number is 603-577-3003. That's 603-577-3003. You'll get one of our patient services representatives. All of them are very well trained at patient intake, and they can direct you to the right person who will ask you some questions about what your goals are, what your problem is, and get things set up. Most of our patients do come by referral, typically from their primary care provider.
Okay.
So that's one way they do it. And so you can certainly talk to your PCP and ask for a referral to Pain Solutions. And I think it's very reasonable and perfectly appropriate if you are, you are suffering or you're struggling with a chronic pain problem, to ask your PCP, hey, can you set up or facilitate a referral, an evaluation with a pain specialist? It's a very reasonable thing to do in the primary care setting.
Listen, I'm up against the hard break, so we're going to have to say, just stay where you are, and we're going to be back. And once again, if you have a question, give us a call, 978-659-0072. Louis, andiamo, figlio.
Ciao, this is Esther of You, Me, and Sicily. I want to talk to you about Tommy Amin and the great staff at Butcher Boy Market. Families, foodies, and home chefs come together at Butcher Boy to talk good food and create traditions. They offer the best in quality cuts of beef, pork, lamb, poultry, and restaurant-style steaks and chops. Produce? All of their produce is hand-selected to complement any meal or even to make it your main course. Their deli serves fresh roast beef, turkey, and beautiful imported Italian cold cuts, cheeses, and antipasto. And don't forget the Butcher Boy Bakery, featuring sweet delectables from all over the state, as well as their very own bakery. That's Butcher Boy, where the secret to a great steak is, of course, the steak. Located at 1077 Osgood Street in North Andover, Massachusetts, in the Butcher Boy Plaza. Ciao.
This is David from the Sicilian Corner. Mike, Tom, and I love to go to Salisbury Beach, but we love different things and can never agree where to go. Tom likes the casual family-style dining with the great Italian cuisine, Capri's seaside Italian kitchen and pizzeria. Me? I love the elegant romantic vibe Sea Glass with the amazing view and terrific menu with prices that make it the place you want to visit each and every week. Mike loves a drink in his hand and a cool ocean breeze right off the surf and the rhythms of a cooler reggae band. We all know Mike loves Bob Marley tunes at Surfside. Who doesn't love a great show? National acts, comedy, regional favorites, and the beautiful and intimate Blue Ocean Concert Hall. Lucky for us, Atlantic Hospitality is the host of all of these great places, and they treat everyone like they are Mike Lamazzo. Best of all, we never have to choose. Park the car once, and all this fun is right at your fingertips. You can have it all in the heart of Salisbury Beach. Find out all the ways you can have a great night at Salisbury Beach at northshorepavilion.com. And Mike, Tom, and I will see you there.
This is Tom Zappala. Located in the heart of downtown Haverhill, the Haverhill Beef Company is a full-service, old-fashioned butcher shop and meat market that continues to be a valued family tradition since 1952. Peter and Monica Carboni's Haverhill Beef offers individualized service from an outstanding selection of marinated sirloin tips, homemade sausage, marinated chicken, and thick, juicy Chairman Reserve steaks. Your family deserves the best, so call Peter at 978-374-4795 or visit their website at www.haverhillbeef.com.
Hi, this is Mike, and I would like to tell you about the Deborah Care Law Offices, a firm that is focused on estate planning, probate, trust administration, and elder law issues. You will feel comfortable discussing important issues concerning both you and your loved ones, as well as having the information you need to make an informed decision about your family's future. How do I know? Because I'm a client of Dan Deborah Care. If you want to have peace of mind knowing that your loved ones are protected, call Deborah Care Law Offices today. In Massachusetts, 978-686-4645. In New Hampshire, 603-894-4141.
At Catadella Funeral Home, we reinvest in our business to provide your family with the best facilities. It begins with a beautifully landscaped exterior, parking for 250 vehicles, and a comfortable and inviting access to our renovated interior. Funerals can be costly, so you should review and compare plans to make sure you receive services that are fairly priced. I invite you to experience the Catadella difference in cost, facility, and service.
Catadella's honoring and celebrating the lives of the people we loved, providing exceptional care since 1929.
Italian artisan cuisine combines simple, fresh ingredients with time-honored preparation to create an incredible culinary experience. At Tuscan Kitchen, located in Salem's historic Depot District, talented chefs prepare everything in-house from scratch for all to see. Guests enjoy their meal literally in our kitchen as food is prepared right in front of you. Wood ovens burn from morning till night, roasting vegetables, baking bread, and firing delightful thin-crust pizzas. Prime steaks are seared on a wood grill. A rotisserie slowly roasts marinated whole chickens and lamb, while a pasta maker creates fresh fettuccine. More than just artisan cuisine, Tuscan Kitchen features the wine bar, live entertainment, weekly wine tastings, and elegant private dining and event space. Call 603-952-4875 or visit TuscanKitchen.com to make a reservation and learn more about the culinary adventure that awaits. In Italy, cooking is an art form. Tuscan Kitchen. Experience artisan Italian.
Orthopedics Northeast and Essex Orthopedics have joined forces as Mobility Bone and Joint Institute to bring improved access and outstanding medical care. While our name has changed, our dedication to exceptional care remains the same as it has for the past 30 years. Same location, 16 Pelham Road, Salem, New Hampshire.
This Labor Day weekend, bring your entire family for the 100th annual Feast of the Three Saints in Lawrence. The best Italian food, free parking, and free entertainment. Stop by the Beer and Wine Gardens, and you'll love the entertainment. A spectacular lineup of talent throughout the weekend. Friday night, enjoy a Phantom of the Opera performance. You'll also see reggae rock artist Joe Samba perform live on stage. Saturday, Chef Marianne Esposito from the PBS series Ciao Italia will hold cooking demonstrations. And Saturday night at 8 on the bandstand, it's the Tre Santi Siciliani Orchestra with tenor Salvatore Bonafini. Come celebrate 100 years of Italian food, fun, and entertainment at this year's Feast of the Three Saints, September 1st through the 3rd in Lawrence. Follow the signs from the Marston Street exit on 495. Sponsored in part by Tuscan Brands, Market Basket, Tripoli Bakery, JG's Ice Cream and Fun Center, Catadella Funeral Home, Trident, Essex Companies, Donna's Sausage, and Jackson Lumber and Millwork. Visit threesaintsinc.org.
This is Cindy.
And Mike Kunstler.
Owners and operators of Four Oaks Country Club and Grazie Italian Restaurant in Drake, Massachusetts.
Grazie Italian Restaurant is the hidden gem of the Merrimack Valley.
Why is that?
We have an incredible chef, Oscar Figueroa.
In the words of local famous chef and restaurant owner Lydia Shire,
Oscar thrives on hard work.
he is capable and gifted.
No one makes better food. Scallops, seared to perfection.
House-made ravioli with farm-fresh local corn.
And buttery, tender, lazy man's lobster, just to name a few.
You have to come experience Grazie Italian Restaurant for yourself.
Grazie Italian Restaurant, located at Four Oaks Country Club, 80 Meadow Creek Drive in Drake, Massachusetts. Hope to see you soon.
And we're back. Our guest once again is Dr. James Mirazita. We're talking about pain, and you're giving out some great information. You really are. Chronic pain, people that suffer from chronic pain in the United States, they outnumber people that are suffering from cancer, heart disease, and diabetes.
Yes, I mean, the number one reason patients go to get medical care for any reason is for pain.
Yeah.
So, and it certainly follows that chronic pain is very common, and unfortunately, treatment of chronic pain is less common. But it doesn't have to be that way. I think if once people understand that there are many options for treatment, it's a good thing that that they understand what their options are and they can seek those options out.
You constantly go to different seminars throughout the country to try and stay in tune with the latest that's out there. And I love that. Louis, when I was going for epidurals with another doctor, it would hurt me I'd almost pass out. It was so painful because he had a different approach.
At the application or afterwards?
Giving me the needle, my blood pressure would drop out of sight, but just giving me the needle, I'd close my fist. One day I put my nail right in the palm. I started to bleed. But I talked to you about this when I first went to meet you. And I said, he gives me the needle and the injection lower than where, and you had a name for it.
Yes, those are called caudal epidurals, and they're
painful.
They're performed very low in the tailbone, and which is an extremely sensitive area, and it is an old technique, a technique from decades past. It's still a good technique. It's still useful today. But I think in many cases, including your case, Mike, I think we have better techniques that are more comfortable. I gotta say, just in the 21 years since I finished my pain fellowship, I've seen incredible advances.
Oh, I can imagine.
In the tools we use and the techniques, and that makes such a difference in patient comfort. I mean, the quality of the needles is far superior. That makes a big difference. We tend to use smaller tools that are much more comfortable. I just as a small example, I've seen the typical needle used for an epidural, went from 16, 17 gauge to now 20 gauge,
So
which
it's
is
like a
far smaller.
pediatric.
Yeah. Yes, exactly. So all of these techniques tend to evolve, and that really increases patient comfort.
Lou, I just want to tell Lou, the first time I met you and had my first treatment, we're talking, and he says, "Okay, I'm going to numb you, and you got to wait it." The regular procedure.
Yep.
So he gave me the injection. I didn't even know I had it. I was waiting for it.
You were bracing, yeah.
He says, "You're all set," because I was so used to what used to take place. I mean, your method and the results has been superior. Now, the flip side of what you do compared to, say, a doctor I had, it's been 38 years since I really damaged my back. I went to a doctor, and I was uncomfortable. I couldn't function. I couldn't have daily activities.
Right.
And every time I'd complain to him, he'd increase the medication. Well, he had me on 4 drugs. I was like a walking zombie. I mean, I was cloud 9.
Yep.
And I said, I can't stay with this guy. I just can't, and I moved on. But the way you treat, and the way the injections go, I'm telling you, folks, you don't even know you're getting it. Seriously, you don't feel that pressure that makes you.
Right.
You can only hold on to the bed so long.
Right. And I think, so much of patient comfort comes from the environment, the staff, and that's why, your crew that's the crew that supports me is so important. There's and all these little tricks that we use in order to make it more comfortable for patients really do make a difference. The other thing
I don't know the situation of Mike's doctor before, but going to a specialist, I imagine someone who's just dealing in pain.
Yes.
Just opens up the range of treatments and more experience.
Absolutely. And, like anything else, you want to go to somebody who does nothing but this day in and day out. It does make a difference. And the other thing I should mention is that, for those that are really sensitive to procedures or have terrible anxiety related to procedures, we do offer our procedures with what's called MAC anesthesia, monitored anesthesia care, where you get an IV and you get sedation. So you're
I didn't know that.
So you're kind of
never
floating
offered
in the
that
clouds.
to me.
Can I just come in for that?
We have had patients ask that in the past.
I'll take it to go.
It's a nice technique because you don't get a breathing tube or anything like that, like you see in, general anesthesia given for surgery. You get the sedation through your IV. It makes you disconnected and anxiety free, and you kind of float through the clouds, but you're always awake enough to talk to me.
2 o'clock. Can I be there too?
Does it work for you? Does chronic pain cover migraine headaches?
Yes. So headaches
How would you treat that?
Are very common, a common ailment in our society. Thankfully, we have a lot of different options for headaches these days. Everything from very effective medications that are not narcotics.
Okay.
So that's one. That's really the mainstay. Typically, a group of medications called the triptans that cause vascular changes within the brain and alleviate the headache. We have some new preventive medications that are given through a subcutaneous injection. That's within the last couple of years. Those have come on the market, also very effective. We also have nerve blocks called greater occipital nerve blocks, where we block the tiny nerves at the back of the occipital area, the back of your skull.
Yeah, I know it well.
Yeah, and those nerves innervate the scalp, and many times when we block those nerves and we apply local anesthetic and steroid around those nerves, they go to sleep. We break the pain cycle, and that can be extremely effective, life-changing for some people.
Wow.
How friendly is your practice and treatments to Medicare, medical insurance?
Very, Medicare, we accept Medicare. We accept all the major insurance payers. If somebody does not have insurance, we do offer payment plans and things like that. And there's with a special price for that treatment. I know patients have come to us over the years and worked out agreeable payment plans. We have a great billing staff that works a lot with patients individually to help them out with billing issues.
Yeah, on that note, I just want to say you accept Medicare payment, but you don't bill over and above that.
That's right. I mean,
that's, I think, for a lot of people, that's huge.
Yeah, I mean, I think I would say Medicare patients in general are a large proportion of our practice, and we love our Medicare patients and the elderly population in general, because we really feel like we can make a big difference in their quality of life.
Absolutely. Listen, we're winding down. We only got a couple of minutes to go. The number one complaint from people that you treat.
Typically low back pain. Spinal pain is about 80% of what we treat. That's right. Very common.
Do I win?
Yes, you win. And so cervical, neck pain, thoracic, mid back pain. But the granddaddy of them all is low back pain, and that's most
number
common.
one.
Yeah,
and
that's
then
the
what,
number
knees?
one.
The knees enter into
Yeah,
this?
knees, the orthopedic surgeons do a really good job in general treating knee pain. But I should mention that we have a new technique called genicular nerve blocks and genicular nerve radiofrequency lesioning that works great for knee pain in patients that have failed all other modalities. So don't give up, if you've tried what you think is commonly done for knee pain and it didn't work for you. It's worth investigating whether these newer techniques would be helpful for you.
Do you have any closing words for our listening audience?
I think
because we're running pretty close to time.
Well, I think the number one thing I would like to highlight is ask for help if you're suffering, if you're struggling with a chronic pain problem. Don't be reticent to ask your primary care doctor or contact a chronic pain clinic directly about treatment options. It's worth the time. It's worth the investment of energy to see if you can be helped with, one of the modern techniques that we do all the time.
Unbelievable. Folks, I want to thank you very much for joining Lou and I here today in the Sicilian Corner, and to our special guest, Dr. Mirazita. Thank you very, very much. I hope we can do this again.
Oh, I hope so too.
Yeah, this was a lot of fun. If you have any questions, once again, call the office, set up an evaluation process, and the process will take you right through the step-by-step. We need to say arrivederci and all that good stuff. And Lou, have a wonderful weekend. Doc, have a wonderful weekend.
You too.
Enjoy, everybody. Take care.